All right. Good afternoon, everyone. Thanks again for joining us. My name is Danae Aber. I'm the Executive Director of the Louisiana Rural Health Association. Thanks for joining us for this Recruitment for Retention Readiness Assessment Overview webinar. LRHA is happy to host this webinar sponsored by Well Ahead Louisiana and presented by Mandy Gingras with 3RNet. This webinar is being recorded and will be available along with a copy of the slides on the webinar recordings page of our website, and I'll drop the link to the relevant page in the chat in just a minute. Your lines are muted when you join, so please remain on mute throughout the session to prevent background noise. You can enter any questions you have at any point in the Q&A box, and we'll address those. After the webinar, a survey should automatically open in your internet browser. We do ask that you please complete that survey. It's very brief, but it does help us to continue to improve our future events and identify potential future education topics that would be valuable to you. And so with that, I would like to welcome Mandy Gingras. She's the Director of Education for 3RNet, the National Rural Recruitment and Retention Network, a nonprofit organization and trusted resource for connecting safety net facilities with health professionals seeking careers in rural and underserved communities. Mandy provides recruitment and retention educational support to safety net facilities across the nation. Throughout her 17 years in healthcare recruitment and workforce consulting, she remains passionate in developing and sharing strategies to attract and retain healthcare professionals who will thrive in rural and underserved communities. So thank you so much, Mandy, for being here, and I'm going to hand it off to you.
Thank you so much, Danae. It's a pleasure to be here. And I have to say, I have really enjoyed the last couple of months working with you and all of the different facilities on this really exciting project. So I wanted to start out with giving just kind of a little snapshot of how what this project looked like. As Danae mentioned, this project was supported and funded by Well Ahead Louisiana and Louisiana Rural Health Association in partnership with 3RNet. And basically what we did was we provided virtual assessments, what we call our recruiting for retention assessments, for 9 selected facilities throughout Louisiana. And early on in the project, I think it was back in June, Danae had sent out kind of an application, if you will, to be able to participate in this project. And 9 facilities were selected to participate. There were 3 rural health clinics that were selected, 3 FQHCs, and 3 rural hospitals were also selected. And there was a strategic process that Danae had followed to be able to disperse the assessments throughout Louisiana into different rural areas throughout Louisiana. And basically what the project entailed was me started out with an interview of the organizations. So speaking with the recruitment teams. So it could be HR directors. In some instances, there was a CEO on the call. Hiring managers participated, anyone that was directly involved with recruitment or retention efforts within the organization. But I scheduled out the initial interviews with the sessions. And then after the interviews gave me an opportunity to really learn a little bit more about each one of the different facilities, learn more about the challenges that they experienced in terms of recruitment and retention. We talked through some of the barriers for them in their recruitment efforts. We also talked through some of their recruitment processes so that I could kind of assess where things are with their in terms of recruitment and retention, and be able to better share some best practices and really point out some of the things that I found that were really doing well. So moving through into the project, once we finished those interviews, then I took a deep dive into the facility's web presence. So Googling the organizations, looking at their website, their job postings, the different social media platforms that they were utilizing, and really looking at those from a candidate's perspective, because we know that today's job seekers are looking at organizations online. They're Googling organizations before they actually apply for jobs. So we know the importance of having a virtual presence. And that was really the main goal of this project, was really to help rural facilities be able to identify what they can do to really boost up their virtual presence and really make sure that they're utilizing all of their marketing online and on their websites, all of their communications, to make sure that they're marketing and really attracting candidates to be as competitive as they can in this kind of virtual environment. And through the assessment process, I also drew attention to all of the great things that I found all of the organizations that I studied were doing, and there were lots of really great things. And the idea of this webinar today is really to kind of walk through all of the different strategies that we identified, kind of as a whole. So some unique challenges, but mostly more of the common challenges that really were not only the strengths that everyone's doing really well, but some of the common challenges and some of the recommendations that I shared with each of the facilities of how they can overcome some of those challenges. So I'm going to share with all of you today some of what my findings were. Here is what I call my executive summary on the findings. And this is really kind of all of the really key pieces that I was able to pull out from doing all of the different assessments. But for the most part, one of the things that really stood out to be very true, a common trend amongst all 9 of the facilities that we had reviewed, was that having a stable and supportive administration was really, really key. All of the safety net facilities are vital to their communities and to the vulnerable populations that they serve. And just from the different interviews that I had with everyone, as well as what I was seeing, just reviewing their presence on the internet, it was really apparent that all of the facilities go above and beyond just providing clinical care. They're really finding out what's important and what's needed in the community to really meet all of those needs for the patients that they serve. And that is another thing that is a really strong selling point, that strong mission and that sense of community that all of the rural facilities have and share. That is a great advantage, especially for today's workforce, because we know that today's employees, today's job seekers, they are all looking for making a difference. They want to make sure that they're fulfilled in their jobs, and they're very passionate and very mission minded. So this is something that really sets all of the safety net sites apart. Having good benefits and a generous PTO plan, those can be really unique selling points that can set safety net sites apart. Also, flexibility is another thing that was a common theme that can really that's a unique selling point that can really set safety nets apart, especially in their marketing and during their communications with candidates as well. We know that having a really strong web presence is really vital in today's virtual recruitment space. So having a strong emphasis on the organization's mission, the community impact, and showing the culture of the organization, those are all really, really key elements that are really important to make sure that you are conveying on your websites, in your job postings, and we'll talk more about that. Through all of the assessments that I did, one common thing that really came up with almost every single assessment I did was that there was really more work needed to create more compelling job postings. So I'm going to spend a little bit of time today sharing with you some best practices in information to include in your job postings. I'm also going to share some examples of some facilities that are doing a really good job of getting their message across in their job postings. And I'm also going to leave you with a lot of different resources to help boost you in the area of making sure your job postings are compelling and they're competitive, and they're also attracting candidates for your job positions. one of the most common things that I found was really needed was there needed to be more of a focus in the job postings on what a candidate wants versus what the organization needs. Most of the job postings that I had come across were just a standard job description with a list of the day-to-day duties or tasks that a candidate might do if they were to join an organization. While that information is certainly very helpful and it's important to share that, it's not a really compelling culture added statement that really kind of lures anyone to apply for a job. So we'll talk more about that when we get to that section. Another thing that was very common, a common trend, was all of the different recruitment barriers that we had talked through and that I was identifying from the different assessments is they were all very common trends. There were very few things that really stood out as unique. A lot of the barriers are very similar to what other rural and underserved communities and facilities face, from having a limited pool of candidates to be able to pull from, having limited staff to be able to really parse out all of the different duties and tasks that are associated with recruitment and retention. We know that HR staff, they wear many, many hats, and they have a lot of work to be done in a 40-hour work week. And that it can be hard to make sure that you're doing everything possible to make sure that your recruitment and retention efforts are up to par when you're working with one staff. Another common trend is limited sourcing options or having a limited budget to be able to market jobs. Competition with neighboring facilities is always a barrier or a challenge in recruitment. Something that we've seen nationwide that has really come to the forefront in the last year or more, last couple of years, is the housing shortages. And it's really hit rural areas even harder because there's a lack of rental opportunities. Housing is very expensive. There's not a lot of new construction going up in rural areas. There might be land available, but you have to be able to build to be able to find affordable housing. And building is not, as we all know, is not always affordable. Attracting outsiders to rural areas has always been a challenge, as well as retention in rural areas. Those are, again, all very common themes that we talked and worked through. But the good news is there are opportunities both on the short term and the long term that I'm going to share with you today that exist to help improve recruitment and retention outcomes, from developing out your recruitment team and finding new ways to market jobs and making connections with training programs. And then there's all different types of engagement strategies that you can utilize with your current employees that are going to help get them engaged in the organization. They're going to foster that fulfillment, sense of belonging, and really encourage retention. So I wanted to share a little bit about some of the website findings that I found through the different assessments. And I wanted to break these out by some of the best practices that I was seeing, and then also some of the common challenges that came up. And as I mentioned, I'm going to be sharing some best practice examples throughout this website here. There's a link here to this community medical center, for you to be able to go into their website and kind of take a peek around at their job boards, their career page, their website in general. They have a lot of really good best practices, and they're a good example of what a compelling candidate-focused website can look like. So I wanted to share that with you. But some of the best practices that I saw, I was really excited with a lot of the facilities in Louisiana. They're doing a really great job. They have great search engine optimization, a lot of clean and modern websites. They were very easy to navigate. I was able to find information that I needed pretty easily. All of the websites that I assessed were all responsive on multiple devices. So I checked from a cell phone, a tablet, from my desktop, obviously. And I was very happy to see that all of the sites were responsive across all different platforms, which is definitely something that we look for to make sure, because we know candidates, majority of them are applying for jobs right from their cell phones. They're doing actively doing their job search from their phones. Everyone did a really great job of showing all the different programs and the services that they offer. Some other best practices I saw, anytime I saw staff photos being utilized, staff being recognized, testimonials, whether they were patient testimonials or employee testimonials, those are all great ways for organizations to be able to speak to the culture of their organization. Um, Having social media links that are easy to navigate and located in a prominent space, like this example here, the social media link is located at the top of the page as opposed to the bottom banner, which a lot of times we never make it to the bottom of a website. So having them at the top is key. Sharing some of the community events and things that are happening in your community is also another great way to really show that community impact and also to show the culture of your organization. Some of the common challenges that I did find from the assessments is not all of the websites or not all of the facilities were really utilizing or fully utilizing their websites as a recruitment tool. So they were missing out on some of these best practices that I mentioned, and they were more patient centric. So it was just basically, it was just a patient portal, and all of the information they were putting out on their website was really geared towards the patient audience. And they weren't taking into consideration candidates that might be looking at their website as a potential employer. A lot, or not a lot, I should say, some of them were, they had utilized stock photos as opposed to actual photos of their teams. And again, showing pictures of your facility, showing pictures and videos of your staff and those testimonials. It just helps candidates that might be looking at your organization, helps them to visualize themselves of how well they might fit in within your organization. It also shows the diversity in your organization as well. So there's a lot of really good benefits of using actual photos of your staff, your people, and your facilities. Most all, there were a couple of websites did a really good job of sharing community information, but most of them missed out on the opportunity to share their community information. I always love to see when organizations use community links or videos in their websites to really highlight their rural communities in a positive light, because we know that there are a lot of misconceptions about rural areas, and even if surrounding communities in your areas might have some misunderstandings about what your community is actually like. So it's always beneficial to provide, make sure you're providing websites that really show your communities in a positive light. A few of the assessments that I had done did not have all of their jobs listed on their website. I found some jobs on Indeed or maybe on Glassdoor that were out there but had not been updated on the website. And so it's always really imperative that you make sure all of the listings on your website are current and up to date. Another thing that I did see from time to time were really complicated, cumbersome application processes that could potentially create a lot of barriers for some candidates to be able to apply for jobs. Several of the assessments I did were really missing that selling information on their career page about really talking about what's in it for the candidate and really touching in on those candidate motivators. And we'll talk through some of that in a few minutes. But one of the common tips that I shared with everyone was to make sure that you're showing your culture, that you're really creating that compelling candidate-focused career page, and that you're making all of your available positions, you're making sure that they're all listed on your website. When I do the virtual assessments, one of the things that I always start out the assessment doing is doing just a Google search on the organization. And this is something that anyone can do. I really recommend that you do this from time to time, just to make sure you know what is out there about your organization, what's being said on the internet. It's so important because we know all candidates that are looking for jobs, they're doing exactly this. Before they apply for your jobs, before they accept an offer, they're looking to see what's being said. We all know about reviews. We know how important they are in our decisions on whether or not to purchase a product. We all go and check out Google reviews on products before we purchase them. So it's the same thing in a job search. Knowing and understanding what other people are saying about an organization is really important when someone's making a decision. So it's helpful to know what comes up. So I would recommend that you do a Google search and see. One of the things I look for, one of the top things I look for, is to make sure that a facility has a business profile on Google. Most of the facilities did, but there were a couple that had missed out on that opportunity. It is a free business page. It's a great way to extend your brand and to make sure that you have a really good SEO or search engine optimization. So I would recommend, and I do have links at the end of the throughout the website to help you if you're not unsure how to set up a business profile on Google. So I'll share some links with you on that. I always like to look at reviews, as because I know candidates do as well. Usually, typically, what you would see as on a Google review would be your patient reviews, and then Indeed and Glassdoor are going to have reviews that are they could be employees, they could be past employees, or they might be reviews from a candidate that maybe applied for one of your positions and went on and left a review. And what I like about Indeed and Glassdoor is this is a really good way to really get a good sense of what others from the outside think about your organization. And Indeed and Glassdoor give candidates that leave reviews, they give them the opportunity to leave pros and cons. And you can really get a lot of valuable feedback and information from looking at both the pros and the cons. One thing I would say about the reviews is make sure that you go in from time to time and review those, look over those reviews, maybe once a quarter. Make sure you have a dedicated person that's looking at those reviews and responding, especially, thanking people for taking the time to leave those reviews, but especially making sure you're addressing those negative reviews, because those can really have an impact on your reputation, especially for potential candidates that might be looking at your facility as an employer. So my biggest tip here would be to make sure that you're addressing any negative reviews that come up. You don't have to solve everybody's problems. You're never going to be able to make everyone happy, but at least taking the time to thank them for leaving feedback. Let them know that you're going to use their feedback to help you improve your processes. Just a simple statement like that really says a lot about an organization and the culture within your organization without actually spelling out what you're actually going to do or if you're actually going to make changes. Social media platforms, I always, as that's part of the assessment process to make sure that organizations are really utilizing those social media platforms, not only as a way to get information to patients, but also as recruitment tools. We know that it's a great way, a great space to really show the culture of an organization. So I like to assess those and point out what they're really doing well and point out things that they might be able to improve on. I also look at community links to be able to find out what's being said out there about the community. Are there really good websites that could be added to an organization's website that really shows the community in that positive light? And I also, part of that assessment process is also kind of evaluating what the competitors are doing. I always say that's a really good way to help you kind of steer you in the direction of what your unique selling points are. Is just having an understanding of what jobs your competitors are hiring for, what are they talking about on their website, their career pages, and how you might be unique from your competitors as well. And then some of the social media best practices, I found all of the sites were really doing a great job of using Facebook, and most of them LinkedIn as well as recruitment tools. They were updating their Facebook definitely frequently, and there was really a nice mix of those public announcements, but also I saw a lot of job postings being put on Facebook, and I love to see shares. And again, it shows that culture. And if you know there's a lot of employees that are sharing job postings out there, obviously there's a really good culture, because we don't refer our friends to jobs, if we're unhappy at our own workplace. Some other best practices are recognizing staff and employees, doing provider intros on social media, talking about your DEI initiatives and your commitment to DEI is really a best practice, talking about loan repayment and scholarship opportunities or eligibility, and also those community events, things that are happening in your community's partnerships, awards that your organization have. These are all great things to be sharing out on social media. And there's an example here of someone, Bay State Health has a really great presence on Facebook. So I shared an example with you all there. For any of you that don't have either a Google or LinkedIn business profiles, they're both free business profiles that you can set up. A great way to extend your brand. Hopefully all of you are utilizing them, and making sure you're posting to them regularly. You can post links, or not links, make posts to LinkedIn, just like you do for Facebook. So all of the same shares that you're doing on Facebook, you can do that all on LinkedIn. And LinkedIn is a really great way to network and get a kind of an organic a cycle of applicants coming into your organization that might find your jobs out on LinkedIn or might just see your profile on LinkedIn. It's also a great way for your staff to be able to engage with the page and then share your job postings within their networks. So I would always make sure that you are sharing your pages with your staff and asking them, inviting them to follow you on LinkedIn, follow you on Google, and you want to make sure that they're using the correct page, because I did see this come up a couple of times with the assessments where there were multiple LinkedIn pages for an organization, and 20, 25, 30 employees might be following the wrong LinkedIn profile. And that happens. There's a couple of different ways that can happen. There could be a misspell, not so much a misspelling in the name of the health center, but let's say Community Health Center also goes by Community Health. And depending on which one is in the official business profile on LinkedIn, if an employee updates their LinkedIn profile and adds Community Health as their job place of employment, but the actual site is Community Health Center, the business profile, it's not going to link the two. And so it then LinkedIn will create another profile for that organization under that abbreviated name. So you want to make sure your staff's following the correct page. LinkedIn also does some really good trends reports. And this is some really great information that came out recently about what candidates or job seekers are looking for, want to see on a website career page. And we know that it's culture and values, perks and benefits, and mission and vision all were what majority of candidates want to be able to find on a website. And most often these three areas were the top three things that were missing from most websites or career pages. So I wanted to draw attention to some of the national studies that are done. This is an example of some of the career page findings that I found from the Louisiana assessments. A lot of really great best practices happening within your state. I was really excited to see that most facilities have a dedicated career page that is located in that main ribbon, which is right there across the top of the website. And that means that the career page is visible no matter what page of the website a candidate might be on. We know that if you have to click more than 3 places to find a career page, it's probably going to be missed. So I was happy to see that it was usually just 1 or 2 clicks brought me right to the career page. It's always a best practice to include your benefits, and a brief description about your application process is always another really good best practice, because it just kind of gives an idea or an expectation of what the candidate might expect next, so kind of that next step in the process. Conveying culture and showing your DEI commitments or initiatives. Again, those are best practices. And there's a number of ways that you can do that. Just speaking to the culture, using photos, using testimonials, providing those links to social media. I mentioned that's really, really important. I'd love to see that on a career page, because we know that employees, if they don't see a job that fits what they're looking for today, but if they like what they've seen from the organization's website, if they can follow you on social media, that's another way for them to be updated when new opportunities become available. So make sure you have those links available. I also love to see when there's a job posting search field available. Also having a clear call to action and a sign up to join your talent community, so that they can be on your mailing list to be updated when you have new opportunities available. Some of the common challenges that I did see, some organizations didn't have all of their job postings. They might have some of their support staff openings or entry-level positions, but maybe they didn't have their providers, like their physician positions were not listed. And if you don't have them up on your website, chances are you're going to have a harder time finding candidates and filling positions. So you want to make sure you have all of those available jobs posted. Cumbersome application process. This is something that does come up from time to time. Whenever a candidate has to download and print out an application, that creates a lot of barriers. Not everyone has access to a printer. And I have seen some application processes where they have to fax back an application. No, very few people have access to a fax machine in today's environment. So you want to make sure you are reducing any barriers for applying to your jobs. Keep it as simple and clear as possible. Another thing that was missing was, which I mentioned, that community information or links from the career pages, and also compelling mission statements, or showing the community impact. Culture statements, those are really very strong and really beneficial to make sure that you're speaking to what the candidate is looking for in an opportunity. Using photos and videos, testimonials to do that, making sure you're including benefits. National Health Service Corps eligibility, that was something that only a couple of the facilities were doing. So I would recommend that can be a really great incentive tool, but it can also be a great retention tool. So make sure that you are staying up to date on your National Health Service Corps eligibility, and also promoting that with on not only with your job postings, but promoting it with your current staff, because that can be a great retention tool. Talking and speaking to the opportunities to teach, if they are applicable, like I mentioned, your DEI initiatives. And then also professional development, because we know that is something that today's job seekers, it's important to them in their jobs, is to be able to have those career ladders, have opportunities to develop themselves, develop their skills, or leadership development is also really important. So speaking to those is really beneficial. And then as far as the job posting process, making sure you have a really clear call to action. Keep that application process simple, remove as many barriers as possible. I love to see an online application, but you don't have to have the online application. You definitely don't want anyone to have to print, mail, or fax anything. Make sure it's mobile friendly. You could have something as easy and simple as an intake form. Just make sure it's quick and simple, and don't overcomplicate it. Or you can just provide some direct email contact information. I personally like to see both. either an intake form or an online application, and the email contact information. Because again, you want to be able to provide multiple ways that people can reach you, because not everyone is going to be able to upload a resume, for instance. It can be difficult to do that from a phone. Um, if some people have trouble somewhere along the lines in filling out your online application, if they have an email contact listed on their website, a candidate would have another way to reach you to find out what other methods they can do to get their application to you. Having that dedicated careers landing page is really vital. Making sure you're including information that that you can offer to the candidate, whether it's your benefits, your employee value propositions, making sure you're including that information on your career page. I've mentioned the videos, the testimonials. Make sure your job openings are easy to update, and you want to make sure nothing is outdated. Here and then I would find opportunities that were from like 2018 or 2019. Make sure if there are dates listed on your job postings, make sure that you're refreshing that so they look like current openings. A lot of organizations were using third-party systems like ADP, Bamboo HR was another one that I had seen to be able to post their jobs. I always like to see a job search function, especially if you have multiple locations, a lot of different job openings. Just having that job search function makes it easy for candidates to be able to put in their specialty, and it will pull out all of the job postings without them having to really kind of sort through all of the different job postings you might have posted. Also, the ability for candidates to follow you on social media right from your job posting is helpful, but also providing a link for candidates to be able to share your job postings, which you can see in the example from this Cole County Community Health Center. Candidates can share jobs right on their own social media links by just simply clicking on the link. It's a great way to get some organic candidate referrals if they have a friend or colleague that might fit the position you're recruiting for. And making sure that your jobs are posted on the major sites like Indeed and Glassdoor. There's a lot of free job posting that you can do. You don't have to have paid job posting for all of the job boards, but there are some that you can actually post for free. I did find that very few of the organizations were posting on the National Health Service Corps Workforce Connector, which again is a free website for you to be able to post and find candidates that are looking specifically for jobs that are eligible for National Health Service Corps. And then sharing the jobs on social media and making sure that you're encouraging your staff to share within their networks is another best practice. With the job postings themselves, some of the common challenges and the recommendations that I was sharing with everyone, almost every single assessment I did, there were some form of a standard detailed job description that was being used as a job posting or a job advertisement. A lot of times I say job posting, what I really mean is it's a job advertisement. What you see here on the screen, this is an example of a typical job description or a job summary. It's not, while yes, it's necessary, it is needed because you want to make sure you have all of your bases covered and you want to make sure candidates understand what they're going to be expected to do day to day. These are not compelling statements that really speak to what's in it for the candidate. For instance, it talks more about what the organization needs to fill the position. So be thinking about your job postings. I always like to say, if you want to include that job summary or the job description, have that at the bottom of your job posting, or maybe even have a link to it in your job posting. But make sure that your opening paragraph is a compelling paragraph that really speaks to what's in it for the candidate, talking about those unique selling points or your value propositions, your benefits, loan repayment eligibility, professional development, whatever those unique selling points are, and then provide details about your culture, your practice environment, your staff, the community, because we know those are all things that candidates are going to be looking for. And that's what's really going to attract them to apply for your jobs. And then again, making sure you have that clear call to action so that candidates know how to apply for your jobs or how to reach you and what that next step is. Just some tips here to really help you in creating more compelling job advertisements. I always like to say, talk to your hiring managers because they're going to be able to give you some really good key information that's really going to help you sell your job postings to candidates. You can find out about what's special about the team that they would be working with. What are the ideal candidate traits that they're going to be looking for? Finding out what types of um, common traits make up their particular teams, and then finding out if there's anything missing from the teams that they might want you to be screening for and looking for in your applicants. Learning about any of the requirements for the position, whether or not there are any specific skills or certifications that are either required or preferred, and making sure that you know what are the deal breakers so that you're not wasting anyone's time. And then I also like to say, get some input from your staff. Find out what matters to them and why they choose to work within your organization. What attracted them to the position? What do they really like about working with the team? What do they really like about your community? Does a couple of different things. One, it's going to give you some really great information that you might be able to use in your job advertising, but also on your website. We'll give you some staff testimonials that you can use to promote your culture. But it can also give you those keywords that you can really, it's going to have a lot of meaning and impact in your marketing efforts. And then make sure that you're asking your staff to help you get the word out about your job opportunities, because they can be a really great marketing team for you and really help share the word within their networks about your opportunities. I always like to share with everyone what candidates are looking for in job postings. And from my experience, almost 20 years doing recruitment for healthcare professionals, these questions really, in a nutshell, really kind of answer all of the questions that almost every single candidate I worked with was always looking to find. The more information you can put out there to answer the candidates' questions, the more successful you're going to be in moving candidates along much faster and much further in that recruitment cycle. So making sure you're including information on your career page, in your job postings about what the practice is going to look like, giving them an understanding of how busy they're going to be, who they're going to be working with, from support staff to other providers, the patient demographics, how you're going to be keeping them safe, whether you have risk mitigation, maybe violence intervention strategies, or prevention programs, or maybe it is malpractice insurance for your providers, whatever the case might be. I talked about those special requirements. Make sure it's very clear what your requirements are, your preferred and your required skills, certifications, experience, whether or not you are eligible for loan repayment or visa sponsorship is also really good information to provide. And then also be prepared to answer this question about why you're recruiting for the position. Doesn't mean you have to put it out there and advertise it, but you should be prepared to share and answer that question when a candidate asks why you are hiring, whether it's a replacement, maybe you have retiring staff, maybe you're growing and expanding. And it's okay if you have high turnover, because in today's economy, most organizations have high turnovers in some departments or within some specialties. So it's okay to admit that and to talk about and be thinking about what you're doing within your organization to overcome some of those reasons. This is also another helpful slide. It speaks to what today's job seeker priorities are, because this will help you, again, kind of craft and create some really compelling information that's going to really help attract candidates to your job postings. So today's candidates, they're looking for more meaning in their work. They want more fulfillment when they go to work every day. They are very passion-driven and mission-driven. Everyone today wants a better work-life balance. So never miss out on the opportunity to talk about all of the great PTO and holiday time. off that they might have within your organization. Everyone wants a positive working culture. There is no longer any tolerance for a toxic work environment. So being able to show and explain what your culture looks like is really going to be valuable when you're recruiting. Having good relationships with managers and leaderships and their coworkers is really important to today's job seekers. So again, using team photos and testimonials to help you get that message across is really key. Flexibility and autonomy in the workplace is another priority. Professional development, career advancement opportunities, we know that's a priority as well. So are DEI initiatives. Having a sense of belonging, feeling included, these are all really important to today's job seekers. Having fair and equal pay and benefits that match their needs is important, as well as recognition and appreciation for all of their efforts. So anything you can say and do to really drill into what your organization does to prioritize these priorities is really going to be helpful for you. So I wanted to include a few examples of job postings, and really this one here points out all of the highlighted areas really speak to some of those candidate motivators that I was talking about. And this is just one example of different ways that you can create a more compelling candidate-focused job posting. So I'm not going to read through this. These examples are here for you. You will have copies of all of these slides so you can really drill into these examples up close. These are a couple more really good example job posts that do a really good job, again, of talking about those motivators and really speaking about the opportunity from the candidate lens. They've included health benefits. This one here is a hygienist opportunity. They talk about growing and professional development. They talk about technology. There's some really great key terms that they've used here. I love the use of having links to testimonials, or this was a video from their CEO in this particular one. And then the OBGYN job posting does a really good job of talking about those expectations of what they might see, from patient volume to types of procedures, the equipment, and then always making sure you have some way for candidates to share the position with their within their friend networks and colleagues is always a best practice as well. These are some really good examples of different organizations that really do a good job of conveying what the culture is within their organization. This is one of the most challenging, and one of the things I get the most questions on is how do we talk about our culture? How do we tell people what our culture is? These are some great examples of how you can really put your culture into words. And I'm going to show you another tool in a couple of minutes that's an AI app that is a free app that you can use to really help you create some really compelling statements. And then DEI, we talked about how important DEI is for today's job seekers. And it no longer can you just simply put out your employee equal opportunity statement and expect that to really be talking about your real sincere commitment. It's just a legal obligation. It's not personal. It's not a sincere commitment. So this is just a couple of examples of organizations, how they speak to the importance that DEI plays within their organization and how they really value diversity. And I also wanted to share with you a couple of links on the Health Workforce Diversity Tracker that's available from Social Mission Alliance. And there's a report for Louisiana's health workforce diversity, which I thought might be really interesting for all of you to know that exists and is out there. And it's a great report that really compares the diversity amongst Louisiana's health workforce. So your current workforce, there's some data there, but there's also some information about training programs in your state and how diverse they are. So you can kind of see what the pipeline looks like in terms of diversity among your different health workforce programs. I believe there were like 16 different programs that are evaluated in that. And it also compares Louisiana's data with national trends too, nationwide. So it's a great report. I wanted you to know that it exists out there. This was the AI job description and job ad content generators that I had mentioned a minute ago. These are really fun to play with. Again, they are free. There's a link to a couple of different ones. There's a lot of different AI content generators out there. These were just a couple that we have experimented with, and they're really easy to use. You can click right on the links, plug in a couple of keywords about your organization or about your jobs, and see what it generates for you. It really creates some really compelling creative content that you might be able to use in your job postings or even on your job boards. A lot of fun to play with. So I want to make sure you had that as a resource. This is another really great resource from LinkedIn to help you come up with job description templates that are a little bit more compelling. And you can see here, this is just an example of a behavioral health technician, but you can literally look up any different healthcare workforce position, whatever title you might want, you can put it in there, and you can tailor it to kind of fit the needs of your organization. But again, it's another starting place to really help you kind of get those creative juices flowing when you're putting together your job advertisements. So great tool to use. I want to talk for a couple minutes here about your unique selling points and to help you kind of think through what you can come up with that really sets your organization apart. I know this was something that most of the sites that I did assessments with when I was doing the interviews, a lot of them really struggled to come up with some of their unique selling points of, what really set them apart. What are they doing that maybe some of their competitors aren't doing as well? So I wanted to be able to provide some really helpful tools and resources to help you kind of identify what really sets you apart so that you can make sure you're including these in all of your marketing materials. And then some of the potential barriers to recruitment, I mentioned all of these were all things that are pretty common nationwide. It's nothing unique to Louisiana or even unique to any of the rural facilities that I did assessments with. And I mentioned a lot of these in my summary at the beginning of our session, but some other additional things were not having a structured sourcing plan to make sure that you're really casting a wide net and really reaching a large audience, having a dedicated recruitment or retention plan to kind of help you through all of the different processes that go along with recruitment and retention. Some of the organizations were really relying on Indeed or maybe even search firms to source candidates. Some organizations don't have incentive programs for referred leads that your employees are referring to you. Not utilizing a lot of sourcing channels, especially some of the free and rural specific sources. Everyone always has trouble communicating their culture. It's easy to talk in a conversation about all of the great things about your organization, but it's hard to really pinpoint that in your marketing. But you want to make sure your marketing is really talking about all of the great things about your organization so that outsiders know that as well. Some organizations were doing a good job about promoting incentive programs like loan repayment, taking a full advantage of visa sponsorship programs, but others were not. So always make sure that you are utilizing those programs and that you understand all of the requirements and eligibility so that you can take advantage of those. Marketing tools and messaging to attract candidates was another common barrier. And we know there's a shortage of candidates from behavioral health professionals, nursing, dental providers, support staff. There's really, the list goes on and on and on about of the different healthcare professionals that are hard to find in today's economy. A lot of organizations were either looking for more ideas to really create more of a structured retention plan or onboarding plans to really support and reduce that turnover. Leadership turnover wasn't as common of a barrier, but it did pop up from time to time. Competition with neighboring hospitals and practices. I was really surprised to see a lot of your communities. There's a lot of competition within a 50-mile radius. And then the perception of rural communities, whether they're lacking diversity or they don't have access to shopping services or maybe spousal satisfaction, all of those common things that we hear a lot about. And I mentioned that housing availability. A lot of your staff is commuting quite a bit of a distance. And with today's high gas prices, we know this can create a lot of barriers and challenges. And childcare options is another thing that we've seen be a new trend that's coming about. Affordable childcare and just having options available to families with young children. These are some resources I wanted to share, and I'm going to just go through these pretty quickly, just so you know that these are available on here. This is a resource guide that the 3RNet has. It's a free guide to help you identify some of your strengths and also identify some of your challenges and ways that you can overcome those. And this guide is broken out into different factors, from geographic to scope of practice factors, also hospital and community support factors. And each of them is broken down into an array of different factors that impact those. And it's a great way to, again, help you pinpoint what your unique selling points are and address some of the challenges or barriers that you might have. It's a great tool. Also wanted to share with you some sources that are working well in today's environment. Recruitment, networking, and retention. I always say you really have to be doing a little bit in each one of these areas. You can't rely just on online job boards to fill all of your recruitment needs. You also need to be networking on your social media channels, communicating with training programs, creating pathway programs. Retention efforts are really vital to make sure that you're keeping your staff. You're developing them, you're creating career ladders, and providing skills training to help engage them in your organization. This is a slide. If you don't have your jobs already posted on 3RNet's job board, this is a slide to help you get started in doing that. You can always reach out to Danae if you need help posting jobs. Also, Nicole Corsi at the Department of Health can help you with job posting on our website, and you can also contact me. I can help steer you in the right direction as well. These are just a listing of other health professional sources that you might not already be utilizing in your job search efforts. Hopefully you are doing a sprinkling of some of these, from social media to some of the job boards and the niche job boards, depending on what your needs are. Reaching out to those training programs, your professional associations, and then those pipeline and pathway programs that your AHEC, your local AHEC program has available. And then I wanted to leave everyone with some of the sample recommendations that I had given to a lot of the organizations through this assessment process. And a lot of these recommendations are utilizing the different resources and guides that are available for free on our website. We have the recruitment and retention guidebooks. We have onboarding plans and processes, satisfaction surveys, a lot of different ways to help you in your recruitment efforts. So I wanted to make sure I just kind of had a sprinkling of some of these recommendations to help you kind of fine tune your processes and really make improvements, small, even if they're small improvements. You know, I don't want to overwhelm anyone, but I wanted to be able to provide the resources and the recommendations and best practices to help you in, like I said, to improve your processes and make sure you're being as competitive as you can. Some of the takeaways, I know we're coming up on at the end of our time, so I just wanted to share in a nutshell some of the takeaways from making sure you're speaking about your culture, making sure you're coming up with those unique selling points within your organization. Top and foremost, use your website, use your social media as a recruitment tool, and make sure you're using storytelling. It's the best way to promote your culture. Use photos and videos and testimonials of your staff to really speak to the culture. And then I also wanted to provide some action steps so that each one of you can go in and perform your own virtual assessments of your organizations. And these are all of the key steps of what I've talked about and shared with you over the last hour of how you can do that. But the last one here, I just want you to know that all of you, the work you do every day is so vital to your communities, and the work you do is so appreciated in your communities. And every community, whether you're in a rural or an urban area, everyone has challenges. No one is perfect, but we can all work on and improve some of those challenges. And so hopefully the tools and the resources I provided today with you all, you'll be able to take those and really implement those within your processes to help you. This here is just a snapshot of some really good best examples. Some examples are best practices of different organizations, whether it's a website, career page, Facebook page. There's even a sample community video here. And then Texas Hospital Association has some really good marketing tips for rural as well. And this little snippet here is a social media post from Bay State Health. We love this one here. It talks about the professional development of one of their staff that went from a custodian all the way to a nurse practitioner within their organization. So just another great way to show the culture of an organization and really promote job growth within an organization. And then last but not least, there's a whole list of all of the different resources that I mentioned that you can use to really improve your processes and really strengthen your recruitment and your retention efforts for the long term. And last but not least is my contact information. So I hope that if you have questions or need additional resources, I love to share information. So please feel free to visit our website, contact me directly if there's anything that I can help you with. So Danae, I know I've gone a minute over, but are there any questions that came up in the chat that I can address?
I don't see any right now, but we'll give it just a couple seconds to see if any questions come in here. And just a reminder, the recording of the webinar along with a copy of the slides will be available on our website within 2 to 3 business days. With the holidays, it may take us a little while to get it up, but it will be linked there. So you guys can go back and review it and look through everything, pull those links that are all throughout the presentation to get access to those resources.
Perfect. Well, thank you all so much for letting me come in and work with all of your facilities. I really enjoyed all of my conversations. You were all lovely to work with. I really enjoyed this project, and I'm glad that I was able to provide some really helpful resources for you in Louisiana.
All right, thank you so much. We appreciate you, all of the assessments that were done before this and then the webinar today. It's going to be really great information for everyone who participated and then anyone who's able to go in and access those resources after. So we greatly appreciate that.
Perfect.
Seeing no questions, we will go ahead and wrap for the day. Thanks again for joining us. As a quick reminder, when you exit, you should see a survey. So please take that to help us improve in the future. And as always, please feel free to reach out to us if you need any assistance and if we can help in any way. Thank you so much and have a very Merry Christmas and Happy Holidays.
You too. Thank you, Danae.
Bye-bye.